Hello guys, welcome to another video with me. As I explained you, I told you about the different types of sinuses. Two of them were the ethmoid sinus, which is located inside the ethmoid bone. The second one is the sphenoid sinus, which is here inside the sphenoid bone. The third one is frontal sinus, which is located in frontal bone. And the fourth one is maxillary sinuses, which is located here. It has triangular shape and it's located in maxillary bone. These maxillary sinuses is important for dentistry student because the infection through the teeth, we can say mostly through premolar teeth, can spread to this sinus. Okay, that's why it's important for us. So we have four types of sinuses inside the bone. The first one is frontal sinus, which is located here. Second one is ethmoid sinus. The third one is a sphenoid sinus, and the fourth one is maxillary sinus. Another view that I want to show you from the skull is this view. So we can see here the purple one, the occipital bone, and in the occipital bone, in the external part of the occipital bone, we have some lines. This line, that we call them superior and inferior nuchal line. Another line, or better to say crest, is located here. This is the occipital crest. What's the function for this line and for this crest? Mostly the line or the crest that are located outside the skull are for projection of sinuses, and it's good for a doctor to diagnose some disease from these projection, because it's very hard to enter to the skull. So for the first diagnosis, better to use this kind of line or crest to know about the different diseases. I didn't tell you about the different types of sinuses, but don't get confused with sinuses which are located inside the bone. We have other sinuses that we call them venous sinus. Venous sinus means a cavity that can have venous blood inside. Venous blood is a kind of blood that has less amount of oxygen. That's why we call them venous blood. So venous sinus can have venous blood. Okay, that finally the venous sinuses should drain into the venous vessel and then to the heart to get oxygen, and again through the aorta or other artery can reach the different organs to supply them. Okay, so there is a foramen here, this foramen, and it's the biggest one, and it's foramen magnum. This foramen magnum is for medulla oblongata and spinal cord. In CNS, we have brain and spinal cord. So we can divide CNS into two parts, brain and spinal cord. The part of brain is medulla oblongata, and the continuation of this medulla oblongata is a spinal cord which pass through these foramen. Okay, in each side of the foramen magnum we have a process. This process is condyle or condylar, occipital condyle, that in lateral part of this condyle we have a canal. This canal is a hypoglossal canal. This hypoglossal canal is for the nerve with the same name, hypoglossal nerve. I told you that these all foramens are for artery, veins, and nerve. For now, you don't need to remember these artery, vein, and nerves, but later I'm going to explain you. Okay? It's about the occipital bone. Another bone which is visible here, it's the pink one, the temporal bone. I explained you about this part. This is the zygomatic arc. Another part which is important in temporal is here. It's mandibular fossa. You know that the lower jaw or mandible can move, but the maxilla can't move. So we have to fix the mandible to the skull through this part. Okay. Another part that is visible here in temporal bone is this. You can say foramen is external acoustic meatus for hearing. And another part which is also important is this part. This is the mastoid process. You can feel the mastoid process a bit behind your ear. It's touchy. You can feel it because it's prominent. It doesn't have hair, and the skin is thin in this part. We can say that the mastoid process is a part of temporal bone, and it's important because inside the mastoid process we have some air cells, and the infection through these air cells can spread to the middle ear, and that's why it's dangerous, and it can cause mastoiditis. um, Another structure that we have here is this foramen. This foramen that is made with the help of two bones, the occipital bone and the temporal bone, is the jugular foramen. You remember that I talked about the sinuses. I didn't talk about different types of sinuses, but I talked what is sinuses. Okay, the sinuses finally want to drain into the venous vessel, right? So the sinuses finally through these foramen will drain into the venous vessel, because the vein inside of the sinus is venous blood. That's why it needs to drain into the venous vessel. Okay. Another part that I want to show you here, it's this bone, Womer. I explained about this bone. The beginning part of this bone is the continuation of the nasal septum. In first video I explained, and the yellow one is the sphenoid bone, that you know that. This part, this green one, is the hard palate, and as you can see the color is green, and you remember that the maxilla in the first video, the color of maxilla was green, so we can say that hard palate is a part of maxilla bone. Okay, and in the posterior part of the hard palate we have soft palate. It's small. Okay. It's another view. It's the same, but there's no color here. Okay guys, thank you so much for watching. I hope you like this video. Please like, share and subscribe.